Hello, and welcome to our Early Childhood Family Leadership Series. My name is Sherelle Bethel, and I'm the Parent Training and Information Director here at Peak Parent Center. Today, you'll be hearing from two wonderful presenters, Heidi White and Danae Davison. Heidi White is the Director of Early Childhood Special Education in the Office of Special Education at the Colorado Department of Education. Over her 14 years at CDE, she has supported early identification and state-funded preschool, including preschool special education. Prior leadership roles include state and community early childhood special education, and early intervention roles. Heidi also has experience as an implementation science consultant to an evidence-based home visiting programs. She is passionate about supporting all children to thrive. Her and her team work to ensure improved outcomes for preschoolers with disabilities and access to high-quality, inclusive preschool experiences. Danae Davison is co-hosting this webinar and is one of our parent advisors here at Peak. She has 3 children, one with Lennox-Gastaut syndrome, who guides her passion for families and special education. You will hear from her in the second part of this presentation. This is the first session in the Early Childhood Family Leadership Series, Navigating Birth through 5 in Special Education. This series is primarily focused on families with younger children. However, it is still full of useful information for families with older children as well. We will have 4 sessions in total and hope that you can join us for all of them. Each of the 4 sessions was developed with a grant and guidance from 2 national partners, the Daisy Center and the Center for Parent Information and Resources. Links to resources in this presentation will be available below this video. From the webpage for this webinar, just scroll down, click the button on the bottom under Resource Files. After each session, we will send you a survey to get your feedback on what worked and what didn't. This is the first run through of this series, so your feedback is very helpful. This series is pre-recorded, so there are no live questions, but if you have any questions either right after you watch this video or anytime in the future, you can always call Peak Parent Center and ask to speak to a parent advisor. Our number is 719-531-9400. Just a note, we do not provide legal services or aid or advice, and the information in this presentation is for general purposes only. The third-party links we provide are not necessarily endorsed by Peak, but are for your further information. There are 4 sessions in total. This first session, as I've mentioned, covers the basics of navigating birth through 5 in special education. Session 2, we will talk about what it means to be a family leader. Session 3, we will dig into the data in Colorado special education, and session 4 will be about getting the most out of your child's special education experience. These sessions do build upon each other, so we recommend watching them all in order. Today, we will discuss what is IDEA, and how does it help my child? How do I start my child in special education? What if I run into problems? How do I choose a school or program? Does anyone else have these issues? Now, I will hand it over to Heidi.
All right, so we're going to talk a little bit about what IDEA is and how it can help your child. IDEA stands for the Individuals with Disabilities Education Act. It's a federal education law which came out of a time when children with disabilities had been excluded from public schools. Prior to its passage in 1975, many children were denied access to education and opportunities to learn. In 1970, for example, prior to the passage of IDEA, U.S. schools educated only 1 in 5 children with disabilities. And many states actually had laws that excluded certain students, including children with hearing or vision impairments, those with emotional or behavioral difficulties, and those with intellectual disabilities. But we know in the real world, people with disabilities have a right to live, work, and socialize alongside those without disabilities. There's no grocery store, for example, just for people with disabilities, thank goodness. When Congress first passed IDEA in 1975, this was done in recognition that disability is a natural part of the human experience. And research shows students with and those without disabilities do better emotionally and academically when children with disabilities are educated alongside children without disabilities. Access to public education for all children, including those with disabilities, represents important legal and civil rights as well as a moral and social imperative. It prepares students for life beyond school, promotes a healthy and empathetic society, and addresses the harms of isolation. By embracing inclusion, we create a richer, more supportive educational environment for all students. And some of the protections in IDEA support this. You'll see these on the left pane of this slide. Equal access, for example, ensures that all students, regardless of their background, their disability, or other factors, have the same opportunities to participate in and benefit from educational programs, regardless of the disability status. Standardization. This implements consistent educational standards and practices to ensure that students receive a comparable level of education and support, often through standardized curricula, assessments, and teaching methods. Rights protection safeguards the legal rights of students, particularly those with disabilities, to ensure they receive the education and services they're entitled to under the IDEA and other pertinent laws like Section 504 of the Rehabilitation Act. Inclusion. This is an important principle in IDEA, which supports the integration of students with disabilities into general education classrooms and activities, which promotes socialization, equality, and access to the general curriculum, rather than segregating them into separate programs. Individualization. This right for every child relates to meeting the unique needs of every student. IDEA requires that education be tailored to meet the specific needs of the student through development and implementation of an IEP, or an individualized education program. This is personalized for each child based on their skills, the goals and needs of each student. And lastly, accountability. This holds schools, educators, and policymakers responsible for providing quality education and services to all students, ensuring that they meet educational standards and the specific needs of students with disabilities. The rights of students with disabilities within the public education system is for each child to have access to a free and appropriate public education within what's called the least restrictive environment. We'll talk a little bit about how this looks kind of on a day-to-day basis for different age groups of children. You'll see that the titles on the right-hand side of the slide represent different segments or parts of the IDEA. For example, the early intervention services are unique in that they're designed to meet the developmental needs of eligible children and families related to enhancing each child's development. In other words, services are designed for the child and the family. If a child and family is eligible for early intervention, an individualized family service plan is developed by the team, which includes the family. These services are selected in collaboration with the family and provided under public supervision by qualified personnel as outlined in the IFSP. Services could include things like speech-language pathology, occupational therapy, physical therapy, vision therapy, applied behavior analysis, counseling, or mental health services, assistive technology, etc. When children move out of the Part C portion of, or early intervention portion of IDEA into preschool services, that is overseen by the public school system. The school districts and what we call special education administrative units work within their school district programs, community programs, or Head Start, or sometimes even through childcare services to ensure that children have access to the services that they need. Generally speaking, the services for children in the preschool age group are offered in part, half, or full day increments each week based upon the services identified in each child's plan and the types of services available through that public school, that local public school system. And then children starting at the age of 5 when they enter kindergarten, based on the cutoff age in their school district, They enter kind of the more formal school system, and the public school district generally supports children with their non-disabled peers in general education classrooms, as we talked about with regard to kind of the right to be included with children who are non-disabled. So that's a quick overview of what the IDEA is and what families can expect across the continuum of birth to 21. We'll move on to the next slide. All right, so now we'll talk a little bit about how do you start a child in early intervention or special education services. The components of the system listed on the left-hand side there are steps in the process with specific timelines. We'll walk through those. These are specific really to the special education system for children 3 to 21. There are specific timelines for children in early intervention who are eligible for an individualized family service plan, which may be slightly different than what we're talking about for the special education system for children 3 to 21. So I'll try to share a little bit about both when they're different. First, we start with referral. So generally speaking, this is when someone, it can be the parent, or it could be a doctor, or it could be a neighbor or relative, might call or email with concerns. If it's the early intervention system, anyone can make a referral. If it's the special education system, most often it might be a teacher or a parent indicating that they have a concern about a child. And if the teacher, for example, shares a concern, you might be thinking about, do you share the same concerns that the teacher might be expressing? If the child's an infant or toddler and not already in school, if they're not meeting their developmental milestones, or people familiar with them have expressed concerns about whether they might be exhibiting delays, the first step is to make a request for an evaluation. So that time when concerns are being expressed and considered, and we're reaching out to the system, that's what we think of as the referral system. Then we move into an evaluation component of the system. So once a parent has provided written consent for an evaluation, and it would never happen without a parent's written consent, then a multidisciplinary evaluation of the child would be completed. If the child is 3 or older, this evaluation is required to occur within 60 days of when the school district receives the parent's written consent. And the team who evaluates your child will provide information about what to expect and provide a summary of the information collected during the evaluation. You'll be asked to provide input about your child's growth and learning throughout this process. Particularly, the younger the age of the child, the more involvement there typically is from the family in this process. Then we move on to an eligibility piece. Eligibility for early intervention and special education services are specific to each program, but in early intervention, the criteria for accessing services is based on the amount of delay the child exhibits, or in some cases, based upon a medical diagnosis of a condition that results or is likely to result in a lifelong disability. And for school-based services, the criteria for eligibility is based upon whether the child needs specialized instruction in school in order to benefit from and make progress in the curriculum. After the child has been determined eligible, a plan is developed. So an individualized education program is created within 30 days of the date of eligibility and no more than 90 days from when the parent provided consent for the evaluation. If the child has an individualized family service plan through early intervention, that must be completed within 45 days from the time the Part C system or the early intervention system received the referral. So some differences in timelines there. Then we move into placement for services and service delivery. Once the appropriate educational setting has been determined, which occurs through the IEP process, services should be started right away per the IEP. And in the IFSP or early intervention system, services are expected to start within 28 days of when the IFSP is developed. And then, of course, there's an ongoing process through the implementation of the plans for monitoring and review. This occurs annually, an annual meeting of the IEP team to discuss the progress. And in early intervention, that happens every 6 months or more often when families request that more regularly, or if there's a need for a review outside of that routine time. We'll talk a little bit here about how to access or where to find services. Who do you go to, or where do you make a referral, that kind of thing. You'll see here on the right hand side that there are some phone numbers and links to websites for each kind of age group that is served under IDEA. In early intervention, there's a process for making a referral online. There are materials, videos, and quite a lot of information to help families and referral sources understand the process and how to get connected to make a request for an evaluation. Once we get into the 3 to 21 system, the public school system is responsible for doing that intake and referral process, completing evaluations, and delivering services. It's really special education is a part of our public education system. And so for 3 and 4-year-olds prior to formal school entry, which generally starts at kindergarten, we have individuals in each school district area called a child find coordinator assigned to each school district area. And there's a directory of those contacts and a school district finder if you're not quite sure which school district your family lives in or is associated with. There are some resources that are linked here in this slide to help with that. An important piece here for 3 and 4-year-olds is that state funding for access to preschool actually comes through the Colorado Department of Early Childhood. So a partner agency to the Department of Education administers some of the funding available to help implement the IEP plan. And so there's also a link there to apply to preschool, but that will be connected to the IEP implementation and delivery. And then for children who are eligible based on their age for kindergarten through 12th grade, or even up to age 21 for secondary transition services, generally speaking, you'll work through your teacher or your school or contact in the school district to access services if you're not already connected. So that's a little bit about how to connect. A few tips to share here. Once your child is participating in early intervention or preschool special education, the special education teacher or service coordinator can help with arranging services or supporting transitions to the next setting that the child is moving to. So for example, when you're moving from receiving services under early intervention as a toddler and preparing to move into school-based services, that service coordinator will be helping coordinate that, connect you to resources, schedule meetings, learn about what your priorities and make sure that your input is being considered in the process. It's also might be helpful to know that Peak Parent Center can provide a template letter to request a special education evaluation for children in the Part B system, so the 3 to 21 system. And it's important also for you to document when you called or made the request for an evaluation, and to save that information, that correspondence between yourself and the public school system or the early intervention system, so that if nothing gets scheduled after a few weeks, you can reach out again, but you also have some documentation about the request that was made. You'll want to learn about IEPs and what makes a strong IEP or an IEP that's going to best meet your child's needs. And Peak has a lot of resources which are listed at the end of this presentation that will support you in that process. It's really hard to develop a strong or the best IEP possible for your child without a lot of input from you as a parent. And so those resources will help support you to make sure that you're contributing as much as you can to that process. For children 5 and older, if the child's already enrolled in school, it's helpful to also include the request to the child's principal and the child's teacher, as well as a special education contact if there is one, or the special education director if you need some additional support in making sure that the evaluation moves forward. All right, so all of these links will be under the resources button All right, so we're going to talk a little bit about choice and placement as it relates to IDEA. This is an area where parents might have some confusion or sometimes even some anxiety about how to evaluate choices, how to know what all of the options are, how to convey preferences and make requests to make sure that your input is considered and that you understand what options are available to your child. So I want to start by just saying that each child's IEP process is what really informs where services can or will be provided. Within the public system, and specifically the special education system, parents don't necessarily have a right to make unilateral decisions about the placement and location of where their student's IEP will be implemented. When a parent does make decisions outside of the IEP team and outside of that process, those decisions could impact whether the IEP can be implemented as intended. For example, private schools not governed by the Department of Education or within the public education system do not have responsibility for implementing federal special education entitlements in the same way that the public education system does. And it's important to know that special education is not a specific place. The IEP team individualizes each child's program to meet the student's unique needs. The goals and services should be designed without preset expectations for where the services will be provided. The goals and services are determined first based upon the student's individualized needs. The placement then, which we could think of as an educational setting, refers to the things like the regular classroom or a special classroom, maybe a center-based classroom, sometimes even a special classroom or a special school. Those are educational settings or placements. And IEP teams are expected to discuss the advantages or the disadvantages of the different setting options, and parents are expected to be involved in both program and placement decisions. But decisions about location, which means the specific building or the school or a specific classroom within the building or school, may be an administrative determination after the program and setting have been determined by the IEP team, but they are required to be made with parental input. So in very general terms, IDEA indicates a preference for children to be educated in what we call a regular education classroom. In a regular classroom, the majority of the class is made up of students without disabilities. A regular education teacher is supported with special education teachers and providers coming into that classroom. That's the most inclusive type setting. And children are educated along with grade level peers. So that's one example of a placement. And that idea of placement, for example, a regular education classroom in IDEA, is not the equivalent of the location. To elaborate on this a little bit, I want to share just a quote from the U.S. Department of Education when they addressed this issue by stating, "Historically, we've referred to placement as points along the continuum of options, placement options for a child with a disability. Location is the physical surrounding, such as the classroom, in which a child with a disability receives special education and related services. A public agency may have 2 or more equally appropriate locations that could meet the child's special education and related needs. And school administrators should have the flexibility to assign the child to a particular school or classroom, provided that determination is consistent with the decision of the group determining placement. So that placement decision is part of the IEP process. Parents are involved, and the location might be determined later. In sum, it's helpful for parents to be aware of choices and options and to state preferences to provide input into placement and location decisions. The IDEA affords a student the right to a free and appropriate public education, but not to receive that FAPE at a particular location. Parents certainly always have the right to choose to move outside of the public education system if they want to access private choices without the protections of IDEA. On the right-hand side of this slide, you'll see some links and some information that might help you in thinking about options, placement options, how location might influence your input and preferences that you'll be sharing as a part of the IEP process. Particularly for the children who are not yet school age, you'll want to think about, what will help meet the needs of your family. There are links here, for example, to Colorado Shines, which is a database that includes information about childcare providers, some of whom work with public school systems, and most of our public school systems here in Colorado operate preschool programs directly by the school district, where IEP services can be implemented. And then there is a link there as well to SchoolView, which will help provide information about public school options for children 5 to 21 years old. So kind of at closing here for this slide, I want to remind folks that there are changes that influence what might be available and what works for individual children. So teachers might change. Certainly children are going to be moving from classroom to classroom, from grade to grade. And what works for one child might not work for another. And you can always request an additional IEP meeting to discuss concerns or challenges or emerging needs that you have that perhaps aren't being met. So with that, we'll move on and talk a little bit about procedural safeguards, which you'll want to have access to this information. This is a screenshot of the guide that parents have about the rights and entitlements available to them under IDEA here in Colorado. And this is an important thing for you to have access to and to read and refer to over the course of your child's special education services. So some of the questions that you might have: what if the school takes a long time to make a plan for your child? Or what if you disagree with the school's evaluation of your child's needs or the results of that evaluation? What if the school isn't providing the services or accommodations that are listed in the IEP? All of these questions and many more that you might have over the course of accessing services, you might find answers to in this procedural guidance manual. Procedural safeguards are like a troubleshooting guide designed to protect the rights of parents and children with disabilities, and at the same time to give families and school systems options of how to resolve differences or how to resolve disputes when those arise. So for example, if timelines are not being met, let's say that the school is taking a long time to make a plan or to evaluate your child, procedural safeguards ensure that evaluations and IEP meetings happen within specific timeframes. And those rules can be utilized to hold the school accountable. We talked earlier about the fact that the evaluation should occur within 60 days of the time the school receives your written consent for the evaluation. This procedural safeguards information will give you information about those specific timelines and some ideas about what to do to help resolve disputes. If you disagree with an evaluation, you have the right to request an independent educational evaluation, for example, at the public school system's expense. And information, again, in the guidance here will elaborate a little bit further on some of those rights and entitlements that would help you in a situation where you might have a disagreement about the evaluation results. Let's say that there was inadequate implementation of the IEP. You didn't feel like your child was getting the services that are indicated on their IEP. In that case, you would probably want to start with having conversations about about your concerns with members of the IEP team. Asked to meet again as a team and talk about concerns. But there are ways to escalate your concern or to elevate your concern if it's not being addressed properly. So you can go up to a building principal or a special education director, ultimately who have a right to actually file a complaint with the state education department, the Department of Education, or request a due process hearing to ensure that the school does comply with the IEP. A few other examples here that are also addressed in these procedural guidance include things like decisions being made about your child that you don't feel like you've had adequate input in, perhaps the school not providing the updates that you're requesting on their progress. And this version of the guidelines, or the guide to the procedural safeguards, is brand new. It was developed and published in just April of 2024 this year. The content itself hasn't changed, but it's become a little bit easier to navigate with some links in the document and a lot of resources, as well as available in Spanish. And the Peak Parent Center has staff and resources to help families navigate challenges and concerns about moving through the special education process and accessing the services that your child needs. So I highly encourage you to reach out to someone there as well if you have concerns or need some support in understanding what your rights are.
Oh, that was great. Thank you, Heidi, for joining us. That was an excellent overview of the principles of IDEA law, who to call, what to expect when getting started in special education, and what school choice looks like for students in special education. So such great info. Heidi, so when we were chatting about data and procedural safeguards before this question occurred to me, is anyone else running into these issues? So I made a slide about it. So I'll jump into some of that stuff. Things like, is this normal? Is this just how it's supposed to work? Are kids with disabilities in Colorado making progress? How do other families feel about it? Are they connected? And, is this really helpful? Is this working? So this is where I thought it seemed like a pretty good spot to introduce indicator data. And indicator data is actually answering some of these questions, because the states wonder this as well, and the federal level also wonders about this. So in order to figure out if special education is working, or at least try and figure it out, then data is collected on certain indicators, is the word, and to try to figure out how well it's going. And we will talk again about these in session 3. So I'm just going to kind of introduce you to some types of things here. This slide summarizes the indicators studied for early intervention. The Part B indicators are similar, but they do have some differences and some different indicator numbers and things like that. But right here, I'll just go over the Part C ones. So that top one, indicator 1, timely services. This measures the number of kids 0 to 2, so the Part C ones, who receive early intervention in a timely manner. In that 45 days that Heidi mentioned was the requirement. So does that actually happen? And this is what you can look at to figure that out. And then the next one, indicator 2, about services in natural environments. So what percentage of kids in early intervention are in the home or community-based settings, familiar, comfortable settings where they want to be? That's the goal. And is that working? Child outcomes is indicator 3, and that one is measuring the progress the children are making in 3 key areas. Positive social emotional skills, including those social relationships. Are they able to communicate with other kids in their class? Are they making friends? The acquisition and use of knowledge and skills. So that's early language and communication. Are they starting to recognize any letters and numbers, things like that? How's that going? And also the use of appropriate behaviors to meet their needs. Are they self-regulating at all? Are they figuring out, how to ask for what they need or say what's going on? Those kinds of things. And these can be measured not just like this student is this, meeting the whole trajectory and at the end is the same level as all the other students. So age level expectations, there's that measurement, but there's also another measurement that's about, has this child made progress? Because that's obviously another way to look at it. Indicator 4, family outcomes, measures the percentage of families in Part C who report that early intervention has helped their family know their rights, helped their family know how to communicate better about their children's needs, help their children develop and learn. So in early intervention, especially, it's so much about supporting the family to support the child. And so they measure that actually. And then the timely IFSP is indicator 5. So that one measures the percentage of the 0 to 2 kids for where there's an evaluation, an assessment, and the plan, the IFSP plan, all conducted within the 45-day timeline. It's a little bit like that timely provision. I think this one's a little more specific. I'm not actually totally sure about that. We'll have to ask Heidi later. Okay, and then early childhood transition. So they actually measure the number of children in Part C in early intervention that have a plan to move into preschool. Whether or not they continue in special education is, that's a factor, but it's not, as long as there's a plan is what they're measuring. So whether it's a plan not to continue or a plan to continue, and they actually track that. So it is important that you don't feel completely dropped at the end, but you kind of know where you're heading, and they measure that stuff. So we're going to talk more about the Part B indicators in session 3. And then in session 4, we're actually going to really dive in to one of the indicators to talk about how you can use them to improve your IEP and kind of manage the trajectory of what you focus on for your goals in your IEP. So that'll be fun. I'm going to put a list of the indicators both for Part C and another list for Part B in the resources tab below. They are worth looking at just to see, what kind of things are being assessed to figure out how healthy special education and early intervention services are in Colorado. And then you can actually get really into it and look at your specific school district. And this is my last slide, except for I'll just summarize what's coming up next too. But so second to last slide, I wanted you to know that the information from the indicators is actually published online. So if you want some homework or just interested in how your school district is doing, just look through these links and you can see data about every area. So the column on the left, the blue column, so those are the CCBs, typically the community center boards that administer early intervention. And so, they have them all: Blue Sky, DDRC, Imagine, all of those. They're all on that left one. And then administrative units, AUs, BOCES, Boards of Cooperative Education Services, LEAs, lead education agencies, basically different flavors of school districts. You've probably heard me use school district, Heidi use AUs. I think and it's all jumbled up, but basically my brain works in the kind of old school districty way, but they're also called AUs, LEAs, and BOCES, and probably more things. I can't remember. But these include things like Adams 12, Jeffco, Durango 9R, all of those things are listed in the link on that right in the green. And this data goes back 3 years, and let's see, is there anything else to know? I don't know, it's just pretty interesting. So you can figure out what the biggest issues have been and what the best strengths are in an area for the last 3 years. I think it's really fun to poke around in. It's a lot of data. And if you watch session 3 before you want to dig into those, I'll give you these links again too in that one. But I can we'll explain a little bit about what you're looking at in that session. Okay, and then so just come back for session 2. We're going to talk about what it means to be a family leader. We'll have Megan Bowser give us a fabulous talk and what that has looked like for her and her family, and like how you can be involved, how you can participate, and just other little tips and things like that. So, all right. Thank you. See you next